This is a case of endovascular treatment of a posterior communicating artery aneurysm with flow diversion. This 46-year-old female presented multiple intracranial aneurysms. The right PCOM aneurysm is currently planned for treatment. Prior history includes clipping of a basilar tip aneurysm. Right groin access is obtained through the femoral artery, and a guide catheter, 6 French in size, is advanced into the distal internal carotid artery. Angiogram reveals the short, stubby PCOM aneurysm. Previously clipped basilar aneurysm is also noted. We advance the microcatheter over an 014 wire. And there you can see it in the horizontal cavernous. The microcatheter tip is just behind. And then we advance the microwire and catheter system into the middle cerebral artery. Then the microcatheter is crossing the ophthalmic, the PCOM, and now into the middle cerebral artery. The pipeline device is advanced. There you can see it's being delivered into the middle cerebral artery. You can see the microcatheters herniating backwards, which is quite common. Therefore, distal location of the aneurysm is of paramount importance, especially when dealing with tortuosity. The device is now delivered into the middle cerebral artery, and the whole system is now gradually being withdrawn backwards till we are ideally into the distal ICA, not jailing the ACA. The device is now being pushed. As the device is pushed, the microcatheter herniates backwards. Additional force is being applied to the microcatheter at this point to make sure the full apposition is achieved, and you can see the catheter is being pushed forward. Additional maneuvers are being made with pulling and pushing the catheter to make it open up. You can see the device is somewhat elongated at this point, and there are additional forward forces applied, which makes the device open up farther in the horizontal segment, but the clinoidal segment remains somewhat flattened. Note that the microcatheter has not been fully withdrawn, so this device remains completely retrievable. That last distal part of the device is retrieved, and additional forces applied in the paraclinoid segment. There you can see the device just sprung open in the paraclinoid, and once that is done, the last little bit is simply unsheathed. Then to further compress, you can see the device is being recaptured and additional forces being applied to foreshorten the proximal end of the device. The microcatheter is advanced to recapture the distal end in the proximal right middle cerebral artery. Both microcatheter and delivery are withdrawn. An angiogram confirms excellent wall apposition in the horizontal segment and distally, with apparent stasis in the PCOM aneurysm.